Okay. Alright, today I'm going to show how to do the actually dilatation and curettage in operation theatre. So what instrument do you need is this is the sim speculum. This is the the one we use normally for the gynae procedure. This one is, we call it the porcelain. Porcelain, there will be the cuff and then straight. This one is a cuff porcelain. So it's according to the vaginal position. That's why we use it anteriorly, it will be the cuff upward. And then you can see the tip here. This is the tip of the porcelain. So this is the different from the other instrument. Okay. And then this one is the uterine sound. There is a uterine sound where you can see the length of the uterus, the centimeter 8, 9, 10, 11. These are the centimeter. So it means that if you, this is supposed to be at the uterine fundus, the tip has to touch the fundus, so it will be the resistant area. So according to the uterus length, you will see this is the 8 cm, 8-week size, 10-week size, 12-week gravid uterus size you can estimate. Okay. And this one is the curette, uterine curette. We can have the blind end and a sharp end, and then this one is only one side. So you can see either two ends or you can see the one end. It can be blunt and it can be sharp end curette. And this one is the Higa cervical dilator. There will be the sizes. In a one dilator, there are two sizes. So you can see this one is a number 5. Okay, this is the number 5. Then another one more side is a number 6. So in a 1 tube, you will find the two sides. Okay, normally in a gynae procedure, we use these two. We rarely use a bigger one, but we normally use these two sides. Okay, and then this procedure, this dilator and dilator can be used for the section curettage, for the termination of pregnancy and miscarriage, or sometimes you can use for irregular menses and menstrual bleeding as a diagnostic procedure, or sometimes you can use this as you can use for the hysteroscopy. If when you do the hysteroscopy, the cervix os is closed, then you can use the dilator to dilate the cervix, so that you put the dilator inside the os and you dilate it, so that after that you get the one more size. Normally 5 to 6 we use it. After that you can put the hysteroscope, because hysteroscope diameter is camera diameter is around 5 mm. So it should be normally it is enough for the hysteroscope to introduce. Okay, so and then first, before you go for the session and Q&A, you have to explain to the patient. You can use it in a outpatient, or you can use in a daycare, operation daycare minor procedure. So it has to be in operation theater or at least minor procedure room. You cannot do it in outpatient clinic unless you use a vaginoscope or hysteroscope. That only we can use it in an outpatient clinic. So when you do the session Q&A, you have to inform the patient, get an informed consent. A patient has to sign. Then you put it in an operation theater. Aseptic technique, patient will be under the anesthesia, either spinal or normally we use a spinal, sometimes we can use a GA. Then the patient will be there, lithotomy position, you clean and then drape, empty the bladder. After that, you do the vaginal examination. Of course, you have to wear the surgical gown and wear the glove, okay? Then you do the manual vaginal examination. So you have to make sure the patient, what is the patient's uterus size. So you put the one finger inside the vagina. Another one more is on the abdomen. Then you find the uterus size by the one finger. So if the uterus is inside the pelvic cavity, you cannot find it in the abdomen. Then when you put your finger inside, with your finger, another one finger is touching the cervix, and you can find the uterus in between your two hands. So that is your uterus size. So if it is just at the pelvic, the symphysis pubic, then it will be normal size. If it is, you can find it above the symphysis pubic, that the uterus is enlarged. So it is up to the abdominal cavity. So you can roughly estimate the uterus size and the uterus position. Is it, you need to find, is it anteverted, the move leaning forward, or retroverted, is a backward. You can get information from the vaginal examination. After you finish, you need to use the sim speculum. If you get the assistant can hold the sim speculum. If you don't have the assistant, you can put it there, and it will be nicely positioned in the patient's perineum. Okay. Then after that, when you put the you have to put the lubricant. Either you can use a chlorhexidine or you can use a warm normal saline or warm distilled water. Then you put it there, and then you need to use a false alarm. So this is a false alarm. There's a straight false alarm, so there will be the tip there. So you have to click on the patient's anterior cervical os. Then after that, you have to use a ultrasound, so that you are trying to pull the patient's cervix towards you. But if the cervix is not very posterior, you can nicely put the ultrasound. You don't need the false alarm. So if you cannot, you have to use a false alarm. You pull it inside and you pull it. If not, you don't need to use a false alarm. You just use a ultrasound. So this ultrasound is whichever the gynae procedure, before you put any instrument into the uterus, you need the ultrasound. So you use it. How to hold it? You have to hold it as like you are holding the pencil. You have to hold it like this way. Then you put it here and you put it into the uterine cavity. So this is the blind end of the uterus mannequin. So I will show you here. So this is the uterus. So this is the antevated. This is the ovary. So it will be posterior like that. So you put it inside. So according to the uterus position, if the uterus is antevated, you use this way. It will be like that. If the uterus is a retrovated, you have to use it other way around, because uterus will be moving forward, moving backward. So you can use it this way. So that is how you introduce the ultrasound inside. So you put it in. The moment you hit there, because you know already the uterus is about 8 weeks. If the uterus is 8 weeks size, this is your finger here, number 7, number 8. So you have to put your finger around here 8, so that you are not going to perforate the uterus. So you just put it inside. So the moment you hit there, okay, that is your uterus size. So you know already, you cannot put any instrument beyond this length. So this is your number 7, so 7 centimeter. This is the 7 centimeter uterus size, uterus length. So after this, you get it. Whichever the procedure, whichever the instrument you use it, you need to make sure this is the length. This is the length of the uterus, so you cannot go more than that. Okay. So after that, you can use this. At the time when you are about to do the procedure, you can use a false alarm. So that you put the false alarm to the anterior lip, then you pull it there. Okay, and then you have to use this one inside. Okay, and then you have to put inside and then you have to scrape it. So when you scrape it, it will be this way. Okay, so you put it inside the uterus. Okay, this is the entire uterus. Okay, you put it there. Then when you scrape it, it will be just only like all direction, anterior, lateral, posterior, in a one go. You have to do it. Then after that, it will be after you finish that, there will be there. You can put the gauze here, so that whatever the tissue will be put onto the patient's same speculum, then it will be there. Then after that, you take it out and you put it in a specimen bottle. So when you do it, like supposing this is the uterine fundus, you just try to scrape everything, all the corner in a one go, not like going in, do that and come out, going in. Don't do that. So just straight away you go in and all the corner you do it, then it will be coming out. So when you are doing, how you know that the product of conception is finished, or you are taking too much of tissue. How will you know? There are some signs. One is if you get a greedy sensation, that means that your POC is already finished, which is like you are already hitting the endometrium. So at that time, you should stop the procedure. If you continue doing it, you are thinning all the endometrial layer. Then air bubble, you can see the air bubbles are coming from the cervix, and it will be here. So if you get an air bubble, you are having a greedy sensation. Another one is less bleeding. Compared to the initial procedure, it's less bleeding. That if you see all these signs, you stop the procedure. That means that your POC is already finished. Then after that, you take all these, you take all the tissue from the speculum, then you put it into the specimen bottle. This is the specimen. This is the specimen bottle. So you just try to place the patient name, IC number, the diagnosis, everything, and then you put it inside. Then you close it and you send it for the histopathological examination. So after all finished, you make sure you check again. By right, if you're doing the section curettage or termination of pregnancy, the procedure, after the procedure, you can find that uterus is getting smaller and then no more bleeding. Then after that, only you finish your procedure and then you can send the patient back to the normal, the gynecological ward. So that is all about. So you can use the same technique for the section curettage or hysteroscopy as well. But this one is just an example for the just only for the dilatation and curettage. But you can use the same principle using all the instrument for the other procedure.